What are the things that I should take home as the memories?
If you have seen every day, at the end of the day, there will be one session that will try to summarize all the recent, sometimes not yet published randomized trials. And obviously, I have been yesterday to the first one. You can get a survey within an hour of all what are the new trends or the new very important ideas in the field of clinical research, at least. And that's something really, if you want to get in a few minutes, a glance of what is going on in the field of radiation oncology, or oncology at large, because typically it's multidisciplinary oncology. These are the sessions in which you have to go, that's for sure.
What did they say yesterday?
Yesterday it was mainly on breasts, prostate, and there was also one on head and neck, which was an American study. There were two UK study on breast and an update of the Dutch study on breast, also typically focusing on the parameters to select which type of treatment, adjuvant treatment, mainly with radiation for young women, which seems to be a specific category of women. I'm not an expert in breast, so don't ask me to go into too many details. And then we got two it was American studies on prostate, adjuvant treatment or no adjuvant treatment. Obviously, these are questions that are relevant for the daily clinical life in the field of radiation oncology: hormones, no hormones, how much time, when, for all patients, depending on tumor grade, yes or no. So I found it quite very interesting. There are also, as you said, plenty of different sessions, and we can't cover everything. I've been also to some imaging sessions, as you know, the involvement of functional imaging with PET, but also with fMRI, depending on the locations, is obviously something that we as oncologists, radiation oncologists in particular, have to keep an eye on it, because the better you can delineate your target volume, individualize first, and second, delineate your target volumes, the better treatment, in a sense that you'll be more focused, you'll avoid toxicity, but for sure you will not miss the target. You may go for dose escalation, and for some disease sites, local control is still a major issue. We discussed about prostate, it is, head and neck, it's obviously one, brain is obviously another one, lung, it's not maybe the major focus, but still, even if you have metastatic disease, you would like at least to have control of the disease locally, so that patients do not suffer from the burden of the primary tumor. So obviously, this was also some interesting sessions. Another one, but I think it will be for this morning, is that more and more within Estro, we try to give a little, no, I should not say a little bit, to give some freedom to the young radiation oncologists, because obviously these people are the future of the society and the future of the society, the scientific society, but our society in general. And so they have a path where they have individualized few issues that for them are of interest. It can be scientific issues, but it's also issues regarding their training, or they should get in contact with the big guys to have fellowship, all practical aspects. It's not really of interest for me, but I think it's also something that I would like to highlight, because it's also illustrates the willingness of a society to incorporate, maybe it's not the proper English word, but I mean to involve, that's a better word, to involve the young people into the life of the society, which I believe is something important.
The education program from Estro is most impressive.
I think you are right. I think you are right, because at the end of this year, 2010, I think we will have run 32 or 34 courses.
In 1 year.
In 1 year. In Europe, but also outside Europe. And so we try to make collaboration on request, or sometimes we do ask them, in China, in India, in South America. We have even been to Australia. So that's only for 4 or 5 courses a year. The majority of the course is throughout Europe. And basically, we have the foundation course, if I may use it, radiation biology, radiation physics, 1 or 2 courses, and then evidence-based. And on average, there was 110 participants per course. And obviously, if you ask me just to name one success story, quoted unquoted, of Estro, I would probably mention that one. Although there are others, I'm biased probably, but there are other success stories. But obviously this one is the best, because it fulfills one of the mission of Estro, which was created 30 years ago, as you know,
so
29.
2 years' time, Estro, what are you expecting to see? The next one.
That's a good question. Probably even more multidisciplinarity, because it's hopefully a trend in the different societies, oncologic societies in Europe. We can debate between ourselves, which is wonderful, of course, and we need to do that, but we obviously have to open, because we don't treat a patient with a single modality these days. And obviously multidisciplinarity and interaction between the surgeons, the oncologists, medical oncologists, or the different disease site oncologists, pneumologists, oncologists, gastro-oncologists, whatever you name them, it's obviously the future. And so this is a key word for me. And as I mentioned earlier on during this interview, the trials, because I cannot see progress without trials, and I think a message to the young oncologists: put as many patients as possible into trials, because it's for me the only way to try to learn something, and of course then devote the rest of your time into translational research to make the bridge with the basic scientists, because plenty of things are going over there. It's difficult for us to understand because we have a basic, we don't have a basic training, but at least we need to bridge what they know, what they do, with what we are expecting, and then maybe we'll come out with better treatment in the future.
The next Professor Gregoire, for instance, the next president of Estro.
Yeah.
Thank you very much indeed for helping us. It was really interesting.